How do plastic surgery emergency protocols avoid legal repercussions? When it comes to plastic surgery, understanding how emergency protocols work is essential. These protocols are designed not only to ensure patient safety but also to protect healthcare providers from legal issues. Let's explore how these protocols function in practice. First, compliance with the Emergency Medical Treatment and Labor Act is crucial. This law requires that any patient who arrives at a hospital emergency department must receive a medical screening examination. If an emergency medical condition is identified, the hospital must provide stabilizing treatment. Plastic surgeons are only required to respond to emergencies that specifically need their expertise. For instance, if a patient has a simple laceration, an emergency physician can handle that without needing a plastic surgeon's intervention. Clear agreements between hospitals and surgeons help outline who is responsible for what, which can prevent legal conflicts. Next, hospitals and plastic surgeons create written agreements that detail response times and consultation criteria. These agreements clarify what is expected from each party, helping to limit liability. If a surgeon is busy with another patient, these protocols specify how to manage that situation without risking patient safety or legal repercussions. Informed consent is another key element. Before any procedure, including emergencies, surgeons must explain the risks, benefits, and alternatives to the patient. This documentation is vital. If a patient cannot provide consent in an emergency, protocols guide the surgeon to act in the patient's best interest while ensuring that the clinical necessity is documented. Surgeons also need to be aware of their malpractice insurance limits, especially regarding violations of the Emergency Medical Treatment and Labor Act. Many standard malpractice policies do not cover these violations. Being aware of this encourages surgeons to follow protocols closely, reducing the risk of facing civil penalties. Another important aspect is compliance with the No Surprises Act. This law protects patients from unexpected out-of-network charges during emergency care. Surgeons must practice transparent billing and obtain consent if out-of-network care is necessary after stabilizing the patient. This helps minimize disputes related to billing and financial responsibilities. Lastly, delegation and supervision protocols are vital when tasks are delegated to other qualified staff. These protocols requiring clear identification of who is performing tasks and ensure that physicians oversee these actions. This oversight helps prevent complications and legal claims related to unauthorized practices. By integrating these elements into their emergency protocols, plastic surgery practices can maintain compliance with legal standards, prioritize patient safety, and reduce the risk of malpractice claims. Clear communication, proper documentation, and adherence to regulations form a comprehensive legal safeguard in emergency plastic surgery care. Always remember, if you have specific medical concerns, consulting a healthcare professional is the best course of action.